Hi, Susan Gonzalez here, your Cancer Plan for Life Guide to Optimal Health. I'm talking today with Michele Rosenthal. Michele is a post-traumatic stress disorder expert, having gone through trauma herself in her life, now helps others to recognize post-traumatic stress disorder and also to treat it. Michele is an author, a speaker, a radio show host, and a blogger. So what does PTSD have to do with cancer and cancer survivorship? We're going to get to that in just a minute, but thank you so much, Michele, for taking this time to speak with me and enlighten our listeners on a very, very important and not very well-known subject.
Hey, Susan, thank you so much for putting together such a great format of healing, really. I always feel like we don't heal in isolation, we heal in community. And what you're doing with these kind of interviews creates a community where we can really all sort of be links in the healing chain.
I totally agree with that. And, I think I found you on LinkedIn. And before I started reading your stuff, I never really thought about my cancer treatments actually possibly contributing to PTSD symptoms. So I thought that was really interesting.
Susan, I'm so glad that you brought that up, and that is a great place to start. The thing that has shocked me, coming not from the cancer world, my trauma was medical and a horrific allergic reaction to an antibiotic that turned me into a full-body burn victim. So I lost, 100% of my skin when I came out of the hospital after weeks of being in this quarantine burn unit room. All I've known is trauma. So and nobody at that time in 1981 was talking about trauma to civilian kids. Everyone was talking about PTSD in terms of the military. So it was 24 years before I really understood, oh my God, I was traumatized. No wonder I've been acting so crazy all these years. This is so basic to trauma. And then, of course, I got my PTSD diagnosis, and I thought, oh, now it all fits together. But what I find so interesting is that in the cancer world, nobody talks about trauma, and it has really astounded me. I work with organizations all over South Florida, and I'm meeting with oncology nurses who've been in the field for 30 years, and after sitting down with them, tears just coming down their face saying, I did not know. I'm thinking of one in particular. She said, I've just been working in this field for so long, it never occurred to me cancer was traumatic, and everything you're saying makes sense. I just met with someone who's at a very high-level position in a major not-for-profit here, and she's a breast cancer survivor. And as we were talking, I was telling her, look, I want to do some survivorship things with your audience because we need to educate people about trauma. And she looked at me and she said, Michele, I've been taking all of these IQ tests and brain function tests because it's been 7 years that I've been cancer-free, but my head's not right, and all the tests come back normal. But I'm not normal. Do you think that has to do with trauma? And I said, yes, yes, because, we can call it Chemobrain, but only for so long. And then after that, if you're still struggling, there really very well may be some underlying post-trauma symptoms that are causing you to feel foggy in your head, unable to concentrate, sleep disturbances, mood and emotional dysregulation. So I think this is one of the most important topics we need to discuss in the cancer community. And I'm so glad that you're open to talking about it, because frankly, when I first started talking about this 5 years ago, I won't name the organization, but they're a national organization, and I called and said, look, we need to talk about trauma in the cancer community. And I was just offering to come in and talk, just for free. I wasn't selling anything. I just wanted to help people. And I was flat out told there's no trauma in this cancer community.
Wow. And Michele, it's so interesting that you say that, because I just was reading an article just the other day, in fact, that talked about PTSD and cancer survivorship, and the numbers were staggering. They were saying that 35% of those who have gone through treatment for cancer exhibit full-blown PTSD, and up to 80% can have one or more of the symptoms. So that just really surprised me.
And yet not surprising, Susan, because think about what it is, what trauma is and what cancer is. Trauma is, there's a difference between little t trauma and big T trauma. So, like little t trauma, you didn't get to a meeting on time and your boss was angry and you got chewed out for that. Okay, that can be like a little t trauma. It rocks your world for that day. But we're talking big T trauma, life threatening, life altering, life changing experiences that change not only who you are, but also how you see your place in the world, how you relate to the rest of the world. And in that essence, I mean, how could cancer not be traumatic?
So for someone that thinks maybe I have some signs and symptoms of PTSD, what exactly are they looking at? What should they look for in symptoms?
It's very, very easy to start figuring out, okay, does this apply to me? I'll give you, there are 4 categories of symptoms, but I'll also give you, I'm the founder of healmyptsd.com. And on that website, we have a PTSD self-test. And it is actually the test that I used when I was in therapy for almost 8 years, talking and talking and talking and getting worse and worse and worse. And when I finally started to say, okay, somebody's got to know something more than my therapist does. And I loved him. He was integral in my process, but he really, we got to a point where he just didn't really know what to do with me. And when I started researching, here are my symptoms, I knew I was exhibiting crazy like symptoms. And I started Googling around, what is this? And I started reading the literature about trauma. And that naturally took me to PTSD literature. And I took this test. It has 22 questions. They're based on these 4 categories of symptoms that I'm going to tell you in a minute. And I answered positively to 20 out of the 22 questions. And I thought, okay, now I'm getting somewhere. And then I took that and I went and found a trauma-trained therapist to help me understand what that meant and to actually get a diagnosis. So I offer that because if you're wondering if you have PTSD, but you don't really want to share that yet, but you want to get some more information, healmyptsd.com, and under the education tab, you'll see PTSD test. It's totally anonymous. You can just share it with yourself. And then when you feel like you're ready, you can take that as a conversation point to somebody else. And the 4 categories that these questions are based on are, number 1, avoidance. People with post-traumatic stress disorder avoid everything that reminds them of their trauma at all costs. That means we won't talk about it, won't go back to where it happened, how it happened, no sights, no smells, no sounds. We are traumatized not by an event, but by the information that our senses send to our body, and then the neurophysiological response that we have to that information. And so avoidance is a big PTSD symptom. Nobody wants to, I'll use myself as an example, but I think this will relate to everybody. I came out of the hospital with a huge aversion to the hospital. So I'm sure you can relate to that, right?
Yes, definitely.
So many years later, when my PTSD symptoms actually started causing physical problems, and I wound up back in the hospital for test after test after test, and they thought I had liver cancer actually, so I was going through this whole testing process. You couldn't even relate to me in the hospital. My brain would freeze, my mouth would go dry, my heart would pound. Literally, I would start to shake and I couldn't speak. And the doctors would get so frustrated with me and they would say to my mom, who would be there with me at these appointments, "We can't work with your daughter. What's the matter with her?" and it was because I was having this traumatic response to a trigger. Something that on another day I would have totally avoided. I would never voluntarily have walked back into the hospital. Just like I also wouldn't talk about what was wrong. So it was very hard for me to heal because you couldn't help me because I wasn't willing to go anywhere near the information and the emotion and the fear and the terror and the pain that I was carrying. So number 1, avoidance. Biggest PTSD category. Number 2, the opposite of avoidance, re-experiencing. Can't stop thinking about it. We dream about it. We have nightmares about it, flashbacks about it. Can't stop replaying over and over in your mind. I know there was a moment where I left my body where I actually felt myself dying. And that moment, I just couldn't, it hung over me like a shawl all day, every day. And I would go back and like sort of play with it. What really happened? How did it happen? What was I doing? What was I thinking? What could I have done? Why didn't I keep going? So you just keep going over and over what happened and re-experiencing not just the thought but the feeling, because every thought produces a physical reaction, right? So you're actually recreating that feeling over and over. And then next we have hypervigilance. Well, we call it hyperarousal, but it shows up in a sort of hypervigilance, always expecting the next bad thing. Where's the danger? Where's the threat? High anxiety, exaggerated startle response. Someone just comes into the room and you leap 3 feet in the air. Not for any reason, just because you're in this hypervigilant state. And then the fourth category is mood dysregulation, where we see people constantly swinging from one mood to another, unable to stay in a homeostatic kind of mood. So, for example, we can swing to rage, which is very common. I had huge anger issues at that time in my life. And then the next thing you know, you're in a pool of butter just sobbing and sobbing on the floor, and you just don't even know why. So those are the four categories: avoidance, re-experiencing, hyperarousal, and mood dysregulation. And then within those, to have a PTSD diagnosis, you have to have symptoms in each of those categories that appear for more than 4 weeks and are disruptive to your life. And every person with PTSD will have a different landscape of symptoms. So, for example, a veteran may have flashbacks every day. I did not. But I had a recurring nightmare that someone was trying to kill me that went on for year after year after year. Other people don't. So it's finding what the symptoms are in each category, but it doesn't mean that you have to have every symptom in every category, if that makes sense.
You know, Michele, I'm just listening to you describe these 4 things, and I'm thinking there are so many cancer survivors having gone through treatment. I'm just thinking of myself that we have certain aspects of these 4 points that you just discussed. You know, we might shrug them off to, oh, it's my hormones, oh, it's this, oh, it's that. But I would imagine that with cancer survivors that these are very common symptoms that you would see with cancer survivors. Is that what you're seeing?
I see them in all the speaking that I do, in all of the group work that I do. It's everything starts to pop up. And that's why, and that gets back to what you were saying earlier, the numbers are staggering and yet not surprising, because the thing that we all, I think also, we come through these horrific experiences and then we live with the idea of recurrence. You know that I was told when I left the hospital that if this ever happens to you again, you will die. There will not be a way to save you. So I wear my medic alert. I'm on, for all those so many years, I was on such high alert. I wouldn't even take a Tylenol for a splitting headache because I was terrified it would kill me. So we live with these things and they become normal to us. And we don't always realize that they're normal for a lot of people. That in our traumas, in our illnesses, we're totally individual and unique. And in our healing and recovery, also individual and unique. But in the place in between, we are enormously universal, because these responses we're talking about, Susan, are human and they're normal.
You know, I think that's so important, Michele, for everyone to hear. We often think that we're alone in this, we're the only one that feels this way, and we just don't know where to go. So what if somebody went to the website www.healmyptsd.com and took the test, and they said, wow, I've checked off a lot of these things. What can they do, and when would they know to get outside help?
Well, I'll be honest with you, Susan. PTSD it's not a puppy. It's a full-grown dog. So it's not like my mom loves to say about problems, if you need to solve them when they're small enough to see and big enough to solve, not wait for them to be big enough so that they're a real issue. PTSD, by the time you notice it, you need professional help. And I'm not saying you need years of therapy because therapy does not cure PTSD. But what I am saying is if you're struggling with PTSD, it is the odds are, and I'd say pretty much 100%, although I'm totally open for someone to tell me they didn't need any help at all. But I haven't met that person yet in all the years that I've been doing this work. PTSD is it's difficult to self heal because it has a lot to do with the neurology and the neurophysiology of how you're responding. It has to do with the belief system that got put in place, and it has to do with how you rewire all of the information that's gotten crossed. PTSD is a survival response that's gotten activated and never learned to deactivate. So you could spend years and years studying and studying to learn everything you need to know to try to figure it out and then do it on yourself. Or you could just go get somebody to help you and do it so much more quickly. And the thing about PTSD is the longer it goes on, the more complex, or I should say, the more complicated it becomes, the more embedded it becomes. So I would not recommend saying, oh, I've got PTSD and I'm going to fix it myself. I would say, you've got PTSD, hop back onto the healmyptsd.com website and hit the treatment tab and start looking for what kind of treatment resonates with you. And then start finding practitioners either locally or globally. I work with a global audience. I'm here in South Florida and I work with people here locally, but I work with an enormous number of people across the country in Canada, France, England, Ireland, Bali. There are ways to heal that do not require you to be in the same room with the person helping you. And so my biggest advice is to figure out, okay, you've got PTSD, and then start figuring out what treatment process do you feel most comfortable with? Because the biggest mistake I see in recovery is that everyone thinks it has to be done X. You know, you have to talk about it. No, you really don't. Or you have to do EMDR. That's the only thing. Eye movement desensitization and reprocessing, which I think is a great technique. But if it doesn't resonate with you, it won't help you. So I would say get your diagnosis and start figuring out what's the treatment you want to try, and then find the people to help you. The last thing I would suggest is to sit there and say, well, I'm just going to heal this by myself. Because really what you're doing is losing more time. And who wants to do that?
So someone could go onto that website and look for coaches, and you coach as well online, don't you?
I do. Well, the website is online. I do the personal coaching online, literally like on Skype, where we video conference together so that we can see each other. I also do it by phone. I also do here locally. I work with people. So, and I'm just one person who works in this area. So I think that the thing that I remember when I had my diagnosis, I thought, well, the only way to heal this is by talking about it, and I'm getting sicker talking about it, so what am I going to do? And then I started researching and I realized, no, there are all these alternative ways to heal. I don't even have to talk about it ever again. And I thought, oh, that's awesome. Because I'm sick of talking about it. And so I went down the alternative route, and I'm trained now. I work in both the conscious and the subconscious mind with my clients. And that way, I think, is the best, because you're getting 100% of your brain into the recovery process. And so on the healmyptsd.com website, we have the treatment tab. It's got an overview, not exhaustive. It's some of the top treatment modalities, both traditional and alternative, so there's a lot that you can learn there. My radio show also, which is on changeyouchoose.com. The archives, I've interviewed some of the leading experts in healing PTSD who are the founders of the modalities everybody's using. So those podcasts are there for you to listen to and to learn. The first step in healing is education. The more you know and understand about what's going on and what it takes to heal, the more quickly you'll figure out what your individual recovery process is.
I think that's so true, and I think that's probably why I felt a connection to you, because we have that same message of figure out what it is that's going to work for you and then go with that. And you have a great resource in your blog on the changeyouchoose.com site, just different blog entries on a variety of things that really anyone could use, things on anxiety, and great information.
I think that's true, because in the end, we all, like I was saying before, we're all universal in our post-trauma symptoms. So whether you have PTSD or you just have post-trauma stress, you know, it's not a clinical diagnosis, but it's an unease and an anxiety where there could be calm. And all of it grew out of my own personal journey. You know, 24 years of living with post-traumatic stress disorder, then I got my diagnosis and I went on what I affectionately call my healing rampage. And that took a couple of years. And when I came out the other side and I looked back and I thought, oh my God, if I had just had the information I needed, I might have healed 2 decades ago. And so that's really what all of this is about. The radio show, the books, Before the World Intruded is a whole case study in healing after illness. And the Heal My PTSD website, just a place to come for information. It's built out of my passion for giving people the information that, frankly, Susan, I wish I had had when I was going through it. And now I've been, you know, years and years symptom free, and it's become my mission to save, you know, other people time that I feel I lost unnecessarily.
That's so encouraging. For people to hear that, you know, people that may be struggling with this, or maybe think that they're the only one that is experiencing these things, and then to hear you tell your story, and you've come through it and you've learned, and now you're teaching others what you've learned, is just so encouraging to hear, and to show people that there is hope.
There definitely is.
I just wanted to make sure that everyone knows where to find you online, and where they can look for your books and your podcasts and everything else that you offer.
For PTSD specific information, healmyptsd.com. For more information that's general to the trauma, post-trauma, and the podcast for the radio show, all about how to rebuild your life after trauma, changeyouchoose.com, because it's built on the idea that trauma, in this case cancer, brings change you don't choose. And recovery is about change you do choose. So that's changeyouchoose.com. We've got free webinar series, free podcasts, videos, free downloads for all about how to reclaim your life. Changeyouchoose.com is really a place of survivorship. And how do you live now that you've gone through this? And that's the real focus of the changeyouchoose.com site.
Thanks so much. And I know this is really important information for every cancer survivor out there. And I've seen you on video. I've seen you speak on video, and I was hoping to someday see you in person. You're such a dynamic speaker. I would love to hear what you have to say and experience some of that.
Thank you so much. I would love that. We're doing a lot. I'm speaking at JFK Medical Center, Bethesda Medical Center. I'm working on something with Susan G. Komen right now. So we've got a lot coming up for the fall. Those comprehensive cancer centers that are here at JFK and Bethesda, and of course Susan G. Komen. We've got a lot of great survivorship planning in the works for this fall. So if you're down here, let me know.
I definitely will. And, you know, just listening to this whole thing, I just can't believe that I never even heard or even considered about PTSD after my cancer treatment.
It's amazing, isn't it?
Yeah, it really is. So I would like everyone to have that information, find out Michelle's websites and her books and her podcast and everything. So I will have links to all of that on, I'm probably going to do a blog post and put this audio into the post so people can click easily to everything that Michele has to offer. So I will put a link, if you're watching this on YouTube, I will put a link to the blog post so everything will be much easier for you to access. And thank you so much again, Michele. It's been a real pleasure talking to you, and I know that this information is going to be very valuable to our listeners.
Thanks for your time, Susan, and for your effort in this space.
Okay, well, please share this post and this video and this audio with people that you think it might benefit, and please subscribe to our channel on YouTube. You can find our book at 100perksofcancer.com, 100perksofcancer.com. Also, our cancer survivorship program, cancerplan4life.com, cancerplan4life.com. And thank you so much for listening. Bye-bye.